My name is Christine Valdez, and I have been a hospice nurse for 15 years. I chose this profession because I believed in dignity, the dignity of a peaceful death, of compassionate care, of hope, even in the darkest hours. I believed that everyone deserved mercy in their final moments, that suffering should be eased, not prolonged. I believed these things until the insurance company taught me otherwise. They taught me that mercy is a luxury item, itemized on spreadsheets and denied by men in suits who have never held a dying person's hand. They taught me that some lives are worth saving and others are acceptable losses. They taught me that the system I served was not designed to heal, but to profit from pain. Now I work in the pristine halls of the Whitmore Private Medical Center, where the wealthy come to buy the mercy that was denied to my husband. And I have become something I never intended to be, a student of the very system that destroyed my life, learning its lessons and applying them with surgical precision. This is my story. This is my justice. The morning David died, I was scheduled to work a 12-hour shift at St. Mary's Hospice. I had been caring for terminally ill patients for over a decade, easing their passage from this world with morphine and whispered reassurances. But that morning, I was the one who needed comforting. I was the one watching death approach with calculating eyes. David had been fighting pancreatic cancer for 8 months, 8 months of chemotherapy that made him vomit until he was hollow-eyed and skeletal, 8 months of false hope and crushing disappointments, 8 months of watching the man I loved disappear piece by piece while I remained helpless, a nurse who could ease others' pain but couldn't save her own husband. The experimental treatment was our last hope. KRT cell therapy, promising but expensive. Our insurance, Meridian Health Solutions, had denied it twice. The medical director, Dr. Richard Whitmore, had personally reviewed our case and deemed it investigational and not medically necessary. Those words, not medically necessary, echoed in my mind as I watched David's breathing grow shallow. "Christine," he whispered, his voice barely audible, "I'm scared." I took his hand, feeling how thin his fingers had become. "I know, my love. I know. He died at 6:47 a.m., alone except for me." The monitors flatlined with a steady, accusatory beep. I sat there for 20 minutes, holding his still warm hand, feeling something cold and hard crystallize in my chest. The grief would come later, I knew, but in that moment all I felt was a crystalline clarity about the injustice of it all. 2 weeks later, while sorting through David's papers, I found a newspaper clipping he had saved. It was from the Society Pages, a charity gala for children's cancer research. In the photo, Dr. Richard Whitmore stood with his arm around a young man in a tuxedo. The caption read, "Dr. Richard Whitmore celebrates his son Michael's recovery from lymphoma after successful CAR-T cell therapy treatment." I stared at that photo for a long time. The same treatment that had been denied to my husband had saved Dr. Whitmore's son. The same therapy deemed investigational and not medically necessary for David had been readily available to the family of the man who had signed our denial letter. That night, I researched Dr. Whitmore extensively. I learned about his private practice, the exclusive Whitmore Private Medical Center, where he treated the wealthy and influential. I learned about his personal wealth, his homes, his investments. I learned everything I could about the man who had condemned my husband to death while saving his own son, and I applied for a position at his clinic. Getting hired at the Whitmore Private Medical Center was easier than I had expected. My credentials were impeccable: 15 years of hospice experience, excellent references, specialized training in pain management. During the interview, I spoke passionately about providing compassionate care to patients in their most vulnerable moments. I meant every word, though not in the way they understood. Dr. Whitmore himself conducted the final interview. He was a man in his late 50s, silver-haired and distinguished, with the kind of confident bearing that comes from never having to worry about insurance denials or medical bills. He reviewed my application with approval. "Your experience in hospice care is exactly what we need," he said. "Our patients and their families require someone who understands the delicate balance between hope and acceptance, someone who can help them navigate difficult decisions about end-of-life care." I nodded, maintaining my professional composure. I believe everyone deserves dignity in their final moments, Dr. Whitmore. Everyone deserves the best possible care regardless of their circumstances. He smiled, apparently pleased with my response. I couldn't agree more. That's exactly the philosophy we maintain here at Whitmore Private Medical Center. We never compromise on the quality of care. Never compromise, I repeated, thinking of David. That's admirable. Within a week, I was working in the most exclusive medical facility in the city. The Whitmore Private Medical Center occupied 3 floors of a gleaming downtown building. The lobby looked more like a luxury hotel than a hospital, with marble floors, crystal chandeliers, and fresh flowers. The patient rooms were suites, complete with hardwood floors and views of the city skyline. My patients were titans of industry, politicians, celebrities, and their families. They came here when money was no object, when they needed treatments that ordinary insurance wouldn't cover, when they wanted the best medical care available. They came here for the experimental therapies and cutting-edge treatments that had been denied to people like David. I learned their routines, their vulnerabilities, their fears. I learned about their families, their businesses, their secrets. I learned which of them had made their fortunes in industries that profited from human suffering, pharmaceutical companies, insurance conglomerates, private prisons. I learned which of them had personally made decisions that had condemned others to death, and I began to understand the true scope of the system I was working within. My first patient was Margaret Thornton, the widow of a pharmaceutical executive. She was dying of lung cancer, the same disease that had killed thousands of people who couldn't afford the medications her husband's company had priced out of reach. She was receiving an experimental immunotherapy treatment that cost $50,000 per month, a treatment that was routinely denied to patients with inferior insurance. Mrs. Thornton was a frail woman in her 70s, but she maintained an imperious manner even while dying. She complained constantly about the food, the temperature, the schedule of her treatments. She spoke to me as if I were a servant, snapping her fingers when she wanted attention. "Nurse," she called one morning, "my pain medication isn't working. I need something stronger." I checked her chart. She was already receiving a substantial dose of morphine, more than most patients could tolerate. But at Whitmore Private Medical Center, patient comfort was paramount. There were no restrictions on pain medication, no concerns about addiction in terminal patients. "I can increase your morphine drip," I said, adjusting the IV pump. "This should help with the pain." She nodded dismissively. "It's about time. I shouldn't have to suffer like this." I watched the morphine flow into her bloodstream, thinking about David's final days. He had been in agony, but our insurance had limited his pain medication. The attending physician at the public hospital had apologized, explaining that there were protocols to follow, regulations about controlled substances. David had died in pain because those protocols were more important than his comfort. But Mrs. Thornton would never experience that kind of suffering. Her husband's pharmaceutical fortune would ensure that she died peacefully, free from pain. The same medications that had been rationed for David were unlimited for her. I made a decision that night. I began to study the medication protocols more carefully, learning about dosages, interactions, and effects. I researched the fine line between therapeutic and toxic doses. I learned about the medications that could ease suffering and the ones that could cause it. The system at Whitmore Private Medical Center was designed to give me unprecedented access to patients and their medications. As a hospice nurse, I was responsible for pain management, medication administration, and patient comfort. The doctors made rounds twice daily, but the continuous care was left to the nursing staff. There were no double checks on medication dosages, no rigid protocols about controlled substances. The wealthy patients and their families trusted me implicitly. They saw my years of experience, my compassionate manner, my dedication to patient care. They never questioned my decisions about their medications or treatments. They never suspected that I might have my own agenda. I began to research each patient's background thoroughly. I learned about their careers, their business practices, their personal histories. I discovered which of them had built their fortunes on the suffering of others, which had made decisions that had condemned people like David to death. There was Thomas Brennan, the former CEO of a major insurance company. He had implemented policies that denied coverage for experimental treatments, saving his company millions while condemning thousands to death. He was now receiving an experimental cancer treatment that his own policies would have denied. There was Senator Patricia Hayes, who had voted against health care reform legislation that would have expanded access to life-saving treatments. She was receiving a stem cell therapy that was available only to the wealthy. There was Dr. Michael Chen, a hospital administrator who had cut funding for charity care to increase profits. He was receiving a treatment that would have been available to David if Chen hadn't eliminated the hospital's compassionate care program. Each of them had the blood of innocents on their hands. Each had condemned others to death while ensuring their own survival. Each had the resources to buy the mercy that had been denied to my husband. I began to understand that I was in a unique position. I could provide them with the same level of care that David had received. I could teach them about the dignity of dying without access to life-saving treatments. I could show them what it meant to suffer as the poor suffered. I could give them justice. The first time I killed someone, it was almost an accident. Thomas Brennan was receiving a morphine drip for pain management, and I noticed that his dosage had been increased 3 times in the past week. His body was building tolerance, requiring higher doses to achieve the same effect. I calculated the amount needed to push him over the edge. It would be easy, a simple increase in the drip rate, nothing that would appear suspicious. His death would be attributed to his cancer, a peaceful passing in his sleep. I stood by his bedside watching him sleep. He looked so peaceful, so different from the calculating executive who had condemned thousands to death. His breathing was shallow, labored. He was dying anyway. I would simply be accelerating the process. I reached for the morphine drip, then hesitated. This was murder, I realized. Cold-blooded, premeditated murder. Everything I had sworn to oppose as a nurse, everything I had dedicated my life to preventing. But then I remembered David's face in his final moments, the pain in his eyes, the way he had begged for relief that never came. I remembered the newspaper clipping, the photo of Dr. Whitmore celebrating his son's recovery. I remembered the countless patients I had cared for who had died in agony because they couldn't afford the treatments that were routinely available to people like Brennan. And I increased the morphine drip. Thomas Brennan died peacefully 2 hours later. His family was grateful for my compassionate care, praising my ability to ease his suffering. The death certificate listed cancer as the cause of death. No one questioned the circumstances. I had given him mercy, the same mercy that had been denied to David. He had died without pain, without suffering, without the agony of watching his family struggle to afford his care. He had received exactly what he had given to others. It felt like justice. The second death was more deliberate. Senator Patricia Hayes was receiving a complex cocktail of medications for her treatment. I had studied her medical chart extensively, learning about her allergies, her sensitivities, her current medications. I knew that certain combinations could be fatal, particularly in a patient with her compromised immune system. I waited for the right moment when she was alone in her room late at night. She was sleeping peacefully, unaware that I was standing beside her bed with a syringe filled with the medication that would trigger a fatal allergic reaction. "You voted against healthcare reform," I whispered, though she couldn't hear me. "You condemned thousands to death because you were afraid of losing campaign contributions from the insurance industry." I injected the medication into her IV port and watched as her body began to react. Her breathing became labored, her heart rate increased, her blood pressure dropped. She died within minutes, her body going into anaphylactic shock. The death was attributed to complications from her cancer treatment. Her family mourned her passing, grateful that she had died peacefully in her sleep. No one suspected that her death had been anything other than natural. I had given her the same consideration she had given to the people who had died because of her votes. She had experienced the same mercy she had shown to families like mine. As the weeks passed, I became more skilled at my work. I learned to read medical charts like a roadmap to death, identifying the vulnerabilities that could be exploited. I studied the interactions between medications, the fine line between therapeutic and toxic doses. I became an expert in the art of undetectable murder. Dr. Michael Chen died of what appeared to be a heart attack, induced by a carefully calculated overdose of his cardiac medication. Mrs. Elizabeth Morrison, the widow of a pharmaceutical executive, died of respiratory failure after I adjusted her breathing treatment. Each death appeared natural. Each was mourned by families who praised my compassionate care. I kept detailed records of each patient's background, their crimes against humanity, their roles in the system that had killed David. I justified each death with meticulous research, ensuring that only the truly guilty received my special attention. I was not a random killer, I was an agent of justice, balancing the scales that had been tipped against the innocent. The irony was not lost on me. I was working in the very system that had condemned my husband, using the resources and privileges available only to the wealthy to exact revenge on those who had created this system. I was giving them the same quality of care that they had deemed appropriate for others. Dr. Whitmore noticed my dedication to patient care. He praised my ability to provide comfort to dying patients, my skill in pain management, my compassionate approach to end-of-life care. He recommended me for a promotion, a salary increase, additional responsibilities. "You have a gift, Christine," he told me one morning. "Your patients and their families consistently praise your care. You have an intuitive understanding of what they need." I nodded, accepting his praise while thinking about the growing list of names in my private notebook. "I believe everyone deserves dignity in their final moments, Dr. Whitmore. Everyone deserves the best possible care." He smiled, the same smile he had given me during my interview. "That's exactly the philosophy we maintain here. We never compromise on the quality of care." "Never compromise," I agreed. I had been working at the clinic for 6 months when I realized that Dr. Whitmore himself was becoming ill. He had been losing weight, looking tired, experiencing what he dismissed as stress-related symptoms. But I recognized the signs. I had seen them in David, in countless patients over the years. Dr. Whitmore was dying. The diagnosis came 3 weeks later: pancreatic cancer, the same disease that had killed David. Dr. Whitmore was devastated, his confidence shattered by the sudden reversal of his role from healer to patient. He began treatment immediately, using every resource at his disposal to fight the disease. He received the experimental treatment that had been denied to David, CAR-T cell therapy, administered in his own clinic, funded by his personal fortune. The irony was perfect. The man who had condemned my husband to death was now receiving the treatment that might have saved him. I watched Dr. Whitmore's condition with clinical interest. The treatment was aggressive, causing severe side effects. He lost weight, his hair fell out, his skin became pale and translucent. But he was receiving the best possible care, the same care that had been denied to David. I began to plan his death with the same careful attention I had given to the others. I studied his medical chart, his medications, his treatment schedule. I identified the vulnerabilities that could be exploited, the opportunities for intervention. But as I watched him suffer through his treatment, I realized something unexpected. Dr. Whitmore was experiencing the same fear, the same desperation, the same hope that David had felt. He was facing the same terrible uncertainty, the same gradual loss of control over his own body. He was human, just as David had been human. He was dying, just as David had died. The night I planned to kill Dr. Whitmore, I sat by his bedside watching him sleep. He looked so different from the confident physician who had denied David's treatment. He looked like what he was, a frightened, dying man, clinging to hope while his body betrayed him. I held the syringe filled with the medication that would end his life. It would be easy, quick, undetectable. He would die peacefully, free from the pain and suffering that awaited him. He would receive the same mercy he had given to David. But as I watched him, I realized something that changed everything. Killing him would not bring David back. It would not undo the injustice of the system. It would not heal the wound in my heart or restore meaning to my life. It would only make me the same as them, someone who decided who lived and who died based on personal judgment rather than justice. Someone who played God with human lives. I had become the very thing I had sworn to oppose. I had become a killer, someone who condemned others to death based on my own criteria. I had become no better than the system I was fighting against. I set the syringe aside and sat back in the chair. Dr. Whitmore stirred in his sleep, mumbling something incoherent. He was fighting the same battle David had fought, facing the same enemy. He was human, flawed and mortal, but human nonetheless. I could not kill him. I could not kill anyone else. I left the Whitmore Private Medical Center the next morning, submitting my resignation with no explanation. I cleared out my locker, said goodbye to my colleagues, and walked out of the gleaming building for the last time. Dr. Whitmore died 6 weeks later after a brave fight against his cancer. His experimental treatment had failed, just as it had failed for David. He died surrounded by his family, receiving the same compassionate care I had provided to countless patients. I attended his funeral, standing in the back of the church among the hundreds of mourners. His son Michael spoke about his father's dedication to healing, his commitment to providing the best possible care to his patients. He spoke about the man who had saved his life with the same experimental treatment that had been denied to others. I realized then that the system was not evil by design, but broken by human flaws. People like Dr. Whitmore, not monsters, but ordinary humans making impossible decisions with limited resources. They were trapped in the same broken system that had failed David, trying to navigate between hope and reality, between profit and compassion. The real enemy was not the doctors or the administrators, but the system itself, a system that forced people to choose between profit and compassion, that made mercy a luxury item, that condemned some to death while saving others. I returned to hospice work, but in a different capacity. I began working with advocacy groups, fighting to expand access to experimental treatments, lobbying for healthcare reform, speaking about the need for universal access to life-saving care. I told David's story and my own to anyone who would listen. I spoke about the injustice of a system that denied treatment based on ability to pay, about the human cost of medical rationing, about the need for fundamental reform. I never spoke about the people I had killed. That knowledge remained mine alone, a burden I would carry for the rest of my life. I had sought justice and found only more injustice. I had sought revenge and found only emptiness. But I had also found something else, a renewed sense of purpose, a commitment to fighting the system through legitimate means, a dedication to preventing others from experiencing the losses that had driven me to murder. I could not bring David back, but I could honor his memory by working to ensure that others would not suffer as he had suffered. I could fight for a system that treated all patients with dignity, that provided mercy to everyone regardless of their ability to pay. I could work for true justice, not the hollow revenge I had sought in the sterile halls of the Whitmore Private Medical Center. This is my story. This is my confession. This is my commitment to spend the rest of my life fighting for the kind of healthcare system that David deserved, that everyone deserves. I am Christine Valdez, and I am a nurse. I have taken lives, and I have saved lives. I have learned that mercy cannot be bought or sold, that justice cannot be achieved through murder, and that the only way to honor the dead is to fight for the living. I have learned that we are all patients in the end, all vulnerable to the same diseases, all dependent on the same broken system. We are all human, flawed and mortal, deserving of compassion and care regardless of our past mistakes or present circumstances. This is my story. This is my truth. This is my hope for a better world.